بسم الله الرحمن الرحيم. اتكلمنا في المحاضرة اللي فاتت عن جزء مهم في الانفكشن بريفنشن اند كنترول، وقلنا اتكلمنا فيه عن الهوسبيتال اكوايرد انفكشنز، وقلنا الديفينيشن بتاعها وازاي بتيجي، وخدنا شوية ديفينيشنز كده مهمين، وعرفنا الريسك فاكتورز والحاجات اللي بتخلي الهوسبيتال اكوايرد انفكشنز تبقى منتشرة وصعبة العلاج. هنكمل برضو جزء تاني دلوقتي عن احنا دلوقتي عرفنا الانواع والاسباب والكده، هنشوف ايه الطريقة اللي ممكن نحد بيها من انتشار الهوسبيتال اكوايرد انفكشنز. عشان كده هنتكلم هنا عن الستاندرد بريكوشنز اوف انفكشن كنترول. المقصود هنا او الانتندد ليرنينج اوتكمز اللي ممكن نطلع بيها من المحاضره دي to enumerate elements of standard precautions, to state types of hand hygiene, to enumerate indications of different types of hygiene, to illustrate techniques of different types of hand hygiene, to state types of personal protective equipment, to enumerate indications of wearing personal protective equipment, to illustrate techniques of wearing and removal of personal protective equipment. الحقيقة احنا عندنا what are the standard precaution, standard infection prevention and control precautions. The aim of the standard infection prevention and control precaution is to break the chain of infection. They are the core measures that should be used at all times in all care settings by all care workers. They are based upon the assumption that every individual should be could be carrying potentially harmful microorganisms, and that there is the potential for transmission of infection. The underlying principle of standard infection prevention and control precautions is that all body fluids must be treated as potentially infectious. Therefore, standard infection prevention and control precautions must be followed at all times. In all situations, the care workers must assess the risk of the task that they are doing and assess both the risks to and from the service users, to themselves and others. The two key elements of standard precautions are hand hygiene and the use of personal protective equipment. Hand hygiene. Good hand hygiene is the most important way to prevent the spread of infection. An intact skin provides an efficient waterproof barrier. Therefore, everyone should look after their skin and cover any breaks in the skin with a waterproof plaster. If skin becomes contaminated with body fluids, they should be washed off as soon as possible. Hand hygiene. What are your hands carrying? They are carrying microorganisms, which categorized as resident microorganisms, transient microorganisms. The resident microorganisms are deep-seated, difficult to remove, part of the body natural defense mechanism, associated with infection following surgery or invasive procedures, especially those involving implants and invasive devices. As for the transient microorganisms, they are superficial, transferred easily to and from the hands, a significant cause of cross-infection, easily removed with good hand hygiene. When should you decontaminate hands? The point of care refers to the service user's immediate environment in which the care worker has contact with the service user or when treatment is taking place. This may be the treatment room, consulting room, or the service user's home. This time represents the point when the risk of transfer of microorganisms is greatest. WHO has identified 5 moments for hand hygiene. Clean your hands before touching a service user, after touching service user and the immediate surroundings, before and an aseptic technique. Clean your hands immediately after an exposure risk to body fluids and after glove removal. Clean your hands after touching any object or furniture in the service user immediate surroundings when leaving, even if the service user has not been touched. Hand hygiene facilities. Hand wash facilities that include as a minimum a hand wash basin supplied with hot and cold water, liquid soap, and disposable paper towels should be available and easily accessible at all hand wash basins that are used by care workers for hand washing. A lack of appropriate facilities should be brought to the attention of the manager and the infection prevention and control lead for the practice. Hand wash basins used by care workers for clinical procedures should be designed as such and have mixer tabs that are wrist, sensor, elbow, or foot operated. These hand wash basins should not be used for any other purpose. Hand hygiene products. The products chosen must be acceptable to the users and not have detrimental effect upon the skin of care workers. Liquid soap. In most care settings, hand washing with liquid soap, preferably one that contains an emollient, and water is all that is required. There is no need to use antibacterial soaps. Liquid soap dispensers should be provided. These should be wall mounted, kept clean, and maintained regularly. Dispensers should have single-use cartridges that are discarded when empty to reduce the risk of accidental contamination and cross-infection. الحقيقة النقطة دي يمكن مش متوفرة عندنا في مصر، لكن بنقول النقطة اللي بعديها بتغطي. Soap dispensers must not be refilled or topped up. بمعنى إن إحنا مش كل ما تفضل نروح مليانها أو إن لما نلاقيها ناقصة نزودها. لا، المفروض إنها لما بتخلص تتاخد، تتغسل، وتتعقم، وبعدين تبقى refilled وترجع في مكانها. As for the paper towels, soft user-friendly paper towels should be provided for drying hands. These should be provided in wall-mounted holders that are easy to use and clean. Cloth towels must not be used. الورق تجفيف الايدين او فوط تجفيف الايدين الورق افضل كتير لان انت بتستعمل مره واحده وبترميها بعد كده. Hand wipes, impregnated hand wipes that are not as effective as hand washing, or the use of alcohol hand rub, and should not be used as a substitute. يعني دي تخليها معاك كده في جيبك لو انت في حته وحسيت ان انت ايدك جت في حاجه تنظف بيها ايدك وخلاص. اوكي. طيب لو ما كانش ايه الحل لما ما بيكونش في بعض الاحيان بنروح في حتت كتيره جدا ونلاقي ان مفيش احواض عشان نستشير الايام، نقول لهم use alcohol hand drops. بس لازم ناخد بالنا من النقط اللي جايه دي لما نستخدم الالكحول في تنظيف الايدين، زي ما انتوا شفتوا مع الجائحه بتاعت الكورونا دي، انتشرت حكايه استخدام الكحول لتطهير الايدي. Alcohol hand drops should be available for use at the point of care، يعني جانب السرير او في جيبك انت الازازه بتاعتك او هكذا. They are available in wall-mounted, portable and small personal dispensers. The most appropriate way for delivering the alcohol hand drop should be chosen and will depend on needs of both service users and care workers. Alcohol hand drops are useful in many situations, especially when delivering domiciliary care, رعاية في المنزل أو كده, and are recommended for use to complement hand washing with soap and water as and when appropriate. يعني مكمل لموضوع الغسيل، لما تغسل ايديك وبعدين بتطهرها بالالكحول. Alcohol hand drops provide a quick and effective method of disinfecting clean hands. وناخد بالنا من clean hands دي مش هتيجي غير بالهاند washing when hand washing facilities are limited. They should be applied using the illustrated 6-stage techniques until the hands are dry. ال 6 stage techniques دي اللي بنستخدمها في الهاند واشنج هنقولها بعد كده. لكن احنا بنستخدم الالكحول، نحط الالكحول في ايدينا وازيف احنا بنعمل بالميه والصابون. After using a maximum of 5 consecutive occasions, hands should be washed with soap and water to prevent a build-up of residue on the hands. برضو علشان كل ما بتعمل انت بتسيب طبقة فبتبقى في بقايا موجودة على الايدين، فيستحسن ان انت كل بعد على الاقل على الاكثر يعني 5 مرات الكحول رابس تقدر تعمل ايه غسيل ايدين. They are not suitable for use on hands that are soiled or during outbreaks of diarrhea illness caused by Clostridium difficile and norovirus. الاثنين دول الكحول مش بيأثر فيهم قوي. When washing with soap and water is necessary. Alcohol hand drops used following hand washing with soap and water can be used to achieve hand disinfection prior to carrying out aseptic procedures, including minor surgery. Hand hygiene procedures. Hand hygiene procedures can be considered as routine hand hygiene, hand disinfection, and surgical hand hygiene. Routine hand hygiene ensure that wrists and forearms are exposed by removing any items of clothing that may hinder through the hand hygiene. Effective hand washing involves 4 stages. Preparation requires wetting hands under warm running water before applying liquid soap. The solution must come into contact with all surfaces of the hand. Washing using soap and water and applying the recommended 6-stage technique. Rinsing under warm clean running water. Drying with good quality disposable paper towels. Hands should be washed by systematically rubbing all parts of the hands and wrists, being particularly careful to include the areas of the hands which are most frequently missed, like the finger tips, the finger whips, and the thumb. Turn on the tap using elbow if possible. Wet hands before applying liquid soap. Wash hands thoroughly with liquid soap and running water. Following the recommended 6-stage technique, the solution must come into contact with all surfaces of the hand. Rinse hand under running water, holding the hands down. Turn off the taps using the elbows. If elbow operated taps are not available, use a paper towel to turn off the tap. Drying hands thoroughly using a good quality paper towel. Cotton hand towel may harbor bacteria and should not be used. Correct hand drying is essential to aid the removal of transient microorganisms and to protect the integrity of the skin. Hands not dried properly may become dry and cracked, leading to an increased risk of harboring microorganisms. Dispose of towels in a foot-operated bin. Never lift the bin lid by hand to avoid recontamination of hands. Nail brushes should not be used for routine hand washing. Nail brushes can damage the skin, leading to an increased risk of harboring microorganisms or dispersing skin scales. If nail brushes is necessary, it must be single use and disposed of immediately after use. 6 stages of technique of hand washing. In the first, palm to palm, بطن الإيد. بعدين back interdigits from the back of the hand. You wash the interdigits between your hands from the back, and then from the front, from the palm. Okay, then you wash the digits, الصوابع, and you take the thumb alone, wash it again, and then you wash the tips of the fingers. These are the 6 stage technique of hand washing. If you train yourself to use it even in just washing hand after eating, after coming from outside or whatever, you will find these will take not more, with the repetition, not more than 30 or 40 seconds. Just use it. The arrangement or consequence بتاعتها, this is not to forget anything. Okay. Hand disinfection. This is type 2 for hand. This process should be carried out after contact with a service user with a known or suspected infection, or before contact with particularly susceptible service user. It involves the application of an alcohol hand drop after the procedure of routine hand hygiene described above. Okay. زي ما بيقولوا يعني حاجات الناس دلوقتي المنتشره قوي ان الناس ما تسلمش على بعض. طب لو سلمنا على بعض اتس بيتر ان انت اول ما تخش البيت تغسل ايديك، او انت راجع من بره مسكت، كنت راكب مواصلات، كنت فتحت باب قفلت باب، فتخش تغسل ايديك. ويستحسن ان انت تحط برضه الكحول، لان في الوقت بتاع الكوفيد 19 ده العمليه برضه ايه صعبه شويه. او لو انت رايح تكشف على عيان وحاسس ان العيان ده اميونو ديفيشنت، يعني ممكن اي حاجه بسيطه تنقلها له ممكن تسبب له وفاه. طيب على فكرة ممكن برضو في الهاند ديسانفكشن ممكن نستخدم ماتيريالز ممكن تكون مطهرة شوية زي البيتادين او الحاجات دي ممكن يعني. بس هنا النقطة ان بنغسل ايدينا برضو ما يتجاوزش الزمن بتاع الغسيل، او ان انت بتسيب شوية الديسانفكتنت بتاع على ايدك لمدة مثلا دقيقة. لكن احسن حاجة اغسل ايديك بمية وصابون وبعدين اعملها بألكول. نيجي بقى للسيرجيكال هاند هايجين. This process results in the destruction of transient microorganisms and a reduction in the numbers of resident microorganisms. It should be carried out before invasive and aseptic procedures, surgery, insertion of intrauterine contraceptive device. Surgical hand hygiene can be achieved in two ways. Wash hands using the 6-stage technique with an antiseptic hand scrub solution. Lather well and wash all surfaces of the hands and rest for 2 minutes before rinsing and drying with paper towels. The other way, wash hands using soap and water using the 6-stage technique, and then apply 2 applications of 5 milliliter alcohol hand rub or gel. Each application should be applied using the 6-stage technique and allowed to dry. Hand and skin care. An intact skin is a natural barrier to infection. Consequently, all care workers need to be aware of the potentially damaging effect of frequent hand washing and the use of alcohol hand rub. يمكن ناس كتيرة لاحظت الحكاية دي في غسيل الإيدين الأيام دي عشان موضوع الكوفيد 19، وإن الناس بتستخدم ألكول كتير بيلاقوا إن بيحصل في دراينس في الجلد وممكن يعني كمان ناس برضو هي الناس اللي بتستخدم المية في الوضوء مثلا يلاقوا ان ايديهم بتكراك بتقشف كده وممكن توصل لدرجة انها تخر دم. فعشان كده من المهم جدا الاعتناء بحالة السكين. Care workers should protect and maintain their skin integrity and minimize the risk of skin irritation by observing the following. Always wet hands before applying soap. Rinse hands thoroughly after washing to remove all traces of soap. Use good quality paper towels or to dry hands thoroughly, including the area between the fingers. Regularly use an aqueous-based hand creams to keep the skin moist and supple. Do not wear gloves for any longer than is necessary for the task. يعني انت بتلبس الجوانتي وتعمل المهمة بتاعتك whatever المهمة وبعدين تقلعها تغسل ايديك. ولو انت محتاج ان انت هتعمل عملية تانية او مش عملية يعني هتعمل بروسيديور تانية لأي سبب بتلبس جوانتي جديد. البروسيديور هتاخد 10 دقايق نص ساعة ساعة whatever غير وهكذا. Always wash hands thoroughly after removing gloves. Always wear gloves when handling blood, body fluids, secretions and excretions or chemicals. Any care worker who develops a skin irritation or allergy that may be due to the use of hand hygiene products should report this to the manager, their occupational health advisor, and their general practitioner. Bare below the elbow. Bare below the elbow initiative has been recommended. يعني بمعنى ان احنا بنلاقي ان الناس اللي بتلبس السكراب شوز بنلاقي ان تملي الكم بتاعها قصير فوق القلب 5 سم. المفروض كل المنطقه دي تبقى عريانه، لان هي المنطقه اللي تبقى واضحه. لو الواحد لابس هدوم لابس حاجه وجاي دم وبتاع ممكن ما ياخدش باله والكونتامينيشن يبقى، او بودي فلويدز بالذات، في بودي فلويدز ملهاش لون، يعني ممكن الحاجات دي كلها تبقى. واحنا قلنا في الاول ان البودي فلويدز دول بنعتبرهم infectious agents على طول، فيهم مرض، فيهم organisms ممكن تتنقل. This requires all care workers that have direct contact with service users, their equipment and environment, to have short sleeves, not to wear wrist watches, jewelry on the hands or arms other than a plain band, to keep nails short and clean, not to wear artificial nails, nail polish or nail jewelry. Jewelry and wrist watches may become contaminated with and harbor microorganisms. Consequently, care workers providing care should ensure that prior to commencing a shift, all wrist and hand jewelry apart from a plain band is removed. Hand hygiene is an important part of respiratory hygiene and cough etiquette. The following measures will be assist good practice. When coughing, sneezing, wiping, or blowing the nose, cover the nose and mouth with disposable single-use tissue. Dispose of used tissue immediately into appropriate waste stream. Wash hands after coughing, sneezing, wiping, or blowing the nose, or after contact with respiratory secretions. It is better to do it in your sleep. Service users must be educated on the importance of hand hygiene to reduce the risk of cross-infection to themselves and others, and should ensure that care workers responsible for delivering care have decontaminated their hands prior to any contact. Service should be provided with information and advice to the correct 6-stage hand hygiene technique. The second important item in the standard precautions is personal protective equipment. The use of personal protective equipment is essential for health and safety and offers protection both to service users and care workers. PPE is worn in addition to normal work clothes, whether these are the care worker's own or a uniform. Inevitably, the clothes that care workers wear will become contaminated with microorganisms in the course of the day. However, if PPE is utilized when appropriate, then there is little evidence that contamination of clothing plays a major role in the transmission of infection. Personal protective equipment هنكمل فيها. لازم الواحد يقيس في البيرسونال بروتكتيف اكويبمنت يعمل ريسك اسسمنت. هل العمليه اللي هو هيعمل عليها دي داخل فيها هاي ريسك اوف انفكشن ولا ما فيهاش؟ فهو اكوردنج بيختار او بتشوز الايه النوع اللبس اللي هو هيلبسه وهو بيعمل الشغلانه دي. In considering what protective clothing might be necessary in any situation, it is necessary to carry out a risk assessment. This means asking whether the task that is about to be performed gives rise to any possibility of contact or contamination with blood or other body fluids? If the answer is yes, then appropriate protective clothing is necessary. Risk assessment for protective clothing, gloves, aprons, and eye face protection. And then 3 possibilities: low risk, moderate risk, high risk. Low risk: no risk of contact with blood and body fluids, PPE not required. Moderate risk: risk that clothing or skin will be contaminated with body and blood and body fluids, apron and gloves. High risk: risk that eyes, clothing or skin will get splashed with blood and body fluids, eye and face protection, water repellent gowns and gloves. Types of PPE used in healthcare facilities: gloves, gowns, aprons, goggles, face shield, masks and respirators. Gloves. The need of gloves and selection of appropriate ones must be based on a careful risk assessment. This will involve consideration of the actual task to be carried out and the potential risks to both the service user and care workers. Gloves should only be worn if there is a possibility that hands will have contact with blood or body fluids, secretions, excretions, mucus, hazardous substance. An intact skin provides a natural barrier to infection. During any service user contact considered to be social, where there is no contact with the above. Gloves are not required, and hand hygiene using the 6 stage technique is sufficient. النقطة دي بتشرح الكلام اللي احنا قلناه قبل كده. لو احنا داخلين بس هنسأل عيان اخبارك ايه النهارده، اكلت كويس، نمت كويس، مش عارف ايه، ما كشفناش عليه، خلاص يبقى مش هنلبس جلافز. في نفس الوقت احنا عملنا، لو تفتكروا ال5 moments بتوع ال WHO، احنا دخلنا الأوضة بتاعت العيان وما لمسناهوش، بس دخلنا الأوضة وممكن نكون حطينا ايدنا على السرير كده، يبقى لازم نغسل ايدينا. كل ده يلخص الكلمتين. الجلافز تايبس واستخداماتها: patients care gloves, housekeeping gloves, other purpose gloves. البيشنت كير جلافز دول اللي هم بنشوفهم تملي، اللي هم الجوانتيات اللاتكس دي، وبعدين دلوقتي بقوا غيروها، دلوقتي بقت ما هياش لاتكس، بقت مواد تانية عشان اللاتكس بيعمل حساسية. وبعدين في الهاوس كيبنج جلافز اللي هم بيستخدموه الناس اللي بينظفوا، تلاقيهم زي جوانتيات تقيلة وسميكة وبتغطي فوق لحد قرب القلب وكده. other purpose gloves بقى في بتوع الأشعة ليهم بيستخدموا ساعات جلافز بتبقى فيها ليد علشان تقاوم الأشعة لما بييجوا يحطوا إيديهم أو بيمسكوا العيان. بتوع المعمل بيلبسوا جوانتيات خاصة اللي بيشتغلوا في معامل كيمياء وحاجات كده، بيبقى حاجات برضه تبقى بروتكتيف. يعني وفي يعني جوانتيات الحاجات ودي برضه لازم تبقى متوفرة برضه في المعامل، الحاجات السخنة اللي بتمسك أو الحاجات الباردة، يعني لو إن في بيستخدموا ليكويد نيتروجين أو حاجة بيستخدموا جوانتيات تانية. دي أنواع الجوانتيات، لكن اللي إحنا اللي يهمنا فيها الايه البيشنت كير جلافز. ده ملخص امتى نستعمل الجلافز وايه النوع اللي هنستخدمه. الصفحه دي بتقول جلافز في المربع الاول في المربع الاول بيقول لنا ان احنا هنا gloves are not required for procedures where there is minimal risk of cross-infection between service user and care workers. For example, basic care procedures when there is no contact with blood and body fluids, taking recordings, blood pressure, temperature, and pulse. No gloves are do not wear gloves. Okay. في المربع الثاني gloves are required for procedures when there is a risk of cross infection between service users and care workers, and further risk assessment should be undertaken. If there is a risk of exposure to blood and body fluids, if no, non-sterile vinyl gloves are used. If yes, is a sterile field required? If no, no sterile nitrile or synthetic gloves with equivalent properties should be used for venipuncture, taking smears, contact with blood and body fluids, handling specimens, cleaning PG sites, dressing chronic wounds, leg ulcers and pressure sores. If yes, that we need a sterile field required, so like if yes, it is like a sterile examination. Gloves should be used for aseptic procedures, dressing surgical wound, inserting urinary catheter, manipulating sterile surgical gloves should be used for surgical procedures, surgery, insertion of intrauterine contraceptive device. Gloves. Key points for glove use. Gloves must not be reused or washed. Liquid may penetrate through the microscopic holes in the glove. The glove may also be damaged if it comes into contact with oils or silicone-based lotions, disinfectants, or alcohol gel. Wear gloves only when necessary. Unnecessary or overuse of gloves may result in adverse reactions in some susceptible individuals. Gloves must not be used as a substitute for hand washing and hand hygiene. There is a growing incidence of latex allergy, and latex glove use is the single biggest risk factor. Alternatives to latex must therefore be provided. قلنا النيترايل وقلنا الفينايل، الحاجات دي كلها ممكن تبقى احسن، ملهاش تأثير زي اللاتكس في حالات الالرجي. Never use gloves that contain powder. This increases the risk of allergy. Gloves should be changed after contact with each service user and at the end of each procedure. You have to bear in mind that it might be necessary to change gloves between tasks on the same service user to prevent cross-contamination. Gloves worn for specific tasks must be removed before touching uncontaminated areas or, for example, writing in notes. Hands must be washed after gloves have been removed. نبتدي بالخطوة الأولانية. The wrist end of the glove should be held and the glove pulled down gently over the hand during turning it inside out whilst doing this. So شايفين هنا أو في الأول دخل إيده وشد لفوق وقلب الجوانتي، وبعدين هيمسك الجوانتي اللي اتقلع بتاع الإيد دي في الإيد. أصبحت الإيد دي مش protected. So هياخد dispose of the gloves immediately into a paddle operated disposal bin and dispose of the correct waste stream. Wash hands. بيجي بقى في الايد دي بياخد الاندكس وبيدخله تحت الجلاف وبيبتدي يسحب بيه الجلاف لفوق لحد ما يقلعه خالص، وبعدين كل ده بعد كده بيترمي في ال waste collection garbage cans. من ضمن الحاجات البروتكتيف برضه الجاونز، الابرونز، الدرابس. They protect skin and clothes. Water repellent gowns. It is unlikely that water repellent gowns will be required in general practice and should only be worn if there is a risk of splashing of blood and body fluids. Aprons, plastic disposable aprons should be worn whenever there is a possibility that clothing or uniforms may be contaminated with blood or body fluids, or when caring of service users with certain infections. Aprons, a separate apron should be worn for each occasion of care given to each individual service user. Never use or wash single-use disposable aprons to prevent cross-infection. Change aprons between carrying for different service users and between different tasks for the same service user. Aprons and the gloves should be stored in a clean area to avoid contamination. Gowns, aprons, drapes ممكن يبقوا non-textile, lint-free, cotton, polyester and cotton, synthetic micro filaments. Two diagrams بيورونا wearing surgical gown, removing surgical gown. Always remember, during wearing the surgical gown, you are dealing with a sterile gown or clean gown, whatever. So you grab them from the inner side, the side which will be contact with your body. Then you grab it, drop it, and start putting your hands and try to move them towards your shoulders, and someone, the assistant nurse or circulating nurse, will help you to wear the gowns, the sterile gowns. Removing the surgical gowns, don't remove your gloves because they are contaminated and the surface, this surface is contaminated. So you grab and pull it from the front, then try to remove them from your hands, including the gloves, and never to touch the outer surface. During wearing, you are not allowed to touch the outer surface because this is the surface which will face the patient during the operation or whatever procedure هنعملها. And during removing the surgical gown, you are not allowed or also to touch the surface which was facing the blood and whatever results of the operation with your bare hands. Face, mouth, or eye protection. It is likely that face, mouth, and or eye protection will be required routinely in general practice setting. Face and eye protection, goggles, or face shield should be worn if there is a risk that blood or body fluids may splash into eyes. واحنا شفنا الحاجات دي كتير قوي بمناسبة الكوفيد 19 وشفنا الفيس شيلد وشفنا الجوجلز وشفنا الحاجات دي كلها. Respiratory protection through الماسك مش هنتكلم عليه كتير لأن أكيد you had information كتير قوي، لكن أهم حاجة عندنا إن الماوس بيغطي الماسك بيغطي الماوس والنوز، عشان كده ده بيحمي الريسبيراتوري تراكت. بيبقى عادة معمول من multiple layers different porous size علشان تمنع كل حاجة بما فيها الفيروسز. و some of them are waterproof، ما يمنعش بيمنع الفلويد penetration حتى لو كان فيه أي حاجة، بالإضافة طبعا للماسك بيبقى فيه الفيس شيلد بيمنع لو في حاجات زي عمليات الولادة والحاجات دي بيبقى فيها فلويدز كتيرة، فدي ممكن تبوظ الإفكت بتاع شكرا جزيلا.